everyone. Thanks for watching our Speech Goals channel, Toddler Talks with myself, Jasna. Today, I think I was wanting to talk to everyone about the top myths that I hear when I first evaluate a child and what's going through all the parents' minds as they're going through the process of an evaluation with their toddler. Stay tuned for our top myths that I hear from parents about maybe what might be going on with their child and their language skills. So one of the things that I hear often from parents when I evaluate a child is a parent that says to me, I think this is a boy thing, right? Like more boys than girls. This is kind of a boy thing. He just doesn't have the patience to talk. And you know, that might be true that we see a lot more males than females in the area of speech therapy and speech and language delays. However, I do feel like it might be more of a learning style that is actually can cause a speech delay. So for example, we have 3 different kinds of learning styles, one of them being kinesthetic. So those are your hands-on movers and shakers, and they can't sit still, and they like to jump off things and all of that good stuff. I do believe that they have a harder time having the patience to use their words, having the patience to follow directions. And so, yes, I think for a kinesthetic type learner, speech and language delays are pretty common. Is it not necessarily due to sex, for example, male versus female, as much as it is having to do with a learning style or learning preference? Because we definitely have many young girls that also need speech therapy. So I would say no, it's not a boy thing necessarily. Myth number 2, I would say that I also tend to hear from parents that they haven't taught him that skill yet. So sometimes when I evaluate a child and I tell the parent, like, you know, did you notice he's not really looking at me when he's asking me for something? He just kind of grabs it out of my hand without looking. Or did you notice that when he needs help, he'll bring it to me and put it in my lap, but he doesn't really look at me and point to the object. And what I hear very often from parents is, well, I haven't really worked on that with him. This is not necessarily something that a child needs to learn per se by their parent. It's not like colors. So if a child hasn't heard their colors, they might not be able to recognize them or say them. This is an innate communication situation that occurs in all children, that they look at you and they point to objects and to communicate. So it's not necessarily something that you need to teach. And so parents often put the blame on themselves and say, I haven't had time to work with my child on that. I have never done that with him. And sometimes it has nothing to do with whether you've taught that or not. So I would say not speech therapy needs are not because you haven't done something enough of, like, especially pointing and eye gaze. Those are things that are innate in a child and always can be worked on, of course, and they can get better by teaching, but something that's a little bit more naturally occurring in young children. Okay, myth number 3. So what I also hear from parents is, well, he's not communicating well because he doesn't go to daycare, or he's not communicating well because he hasn't been exposed to other children his age. It does help to be around other children. However, going to a daycare or preschool is not necessarily going to take care of the problem or the delay. So a child that is already exhibiting some delays in talking might actually be more frustrated in that kind of environment because it's many more children to be competing with. All the other children can be using words, and they will be in front of the child that has a hard time communicating their needs. So the child that's communicating by signs and grunting, will have to wait in line while the other children are like, I want that, teacher, you know. So although daycare and preschool are a great addition to a program in case the child is needing speech therapy. Speech therapy, I feel like, should be one of the priorities. And getting the child to speak and communicate effectively and be able to use their words or be able to use gestures to communicate with the adults around them is a huge priority over socialization and following a teacher's lead or socializing. Because, the fact of the matter is a child who can't communicate isn't going to socialize very well with other children. They can, maybe non-verbally, by gestures and grunting. However, you kind of want a child to be feeling successful, talking more before they actually get put in an environment like that. And again, I'm not saying that preschool is not a good idea simultaneously. You could do both. But if you haven't gotten started and you're getting started with speech therapy, I would say give that a little while and a little focus. And then as your child becomes more successful, then start looking at preschools. And I would definitely suggest looking at preschools that have experience working with speech delays, because I have heard some very horrible cases where preschools really don't know what to do with an action-oriented kinesthetic child who might be slapping or hitting or biting because they can't communicate their needs, and that's how they say no or mine, and they actually get kicked out of preschool. And that's a whole other topic that maybe we'll go into in the future. I definitely have my thoughts and opinions about kicking kids out of preschool. Not a fan of that, but why don't we think about how we can make the child more successful first and then look at those programs that might be a good fit for your child and yourself. Okay, so myth number 4. I hear very often from parents, my doctor's not really worried about it, but I keep hearing from my family members, like, you should get an evaluation, you should look into something. But when I bring it up to my doctor, he says, everything's fine, let's just wait and see. I'm not a fan of wait and see. And I will mention that to you guys right now. Here's the thing that not a lot of people want to talk about, but pediatricians are experts and have degrees in medical health and not necessarily in speech and language development. So, clear distinction. If you really have a gut instinct that something might be going on and you bring it up to your doctor and they just kind of, blow you over and say, oh, don't worry, we'll look at it later, realize that there's something called early intervention services for regional centers through your local city. And those services are available to you for your child between 0 and 36 months. So when your pediatrician tells you, just wait and see, and your child's 24 months, they could have been receiving another whole 12 months or 1 year of speech therapy or any other developmental therapy prior to their 3rd year. And so that's something for you to consider, is these services are out there in your community. The local regional center will do a free evaluation of your child's skills and determine whether they need services or not. And this is not a wait and see approach. This is get in there, let's see if we can make changes while the children's brains are developing, and hopefully they won't need services as they get older, or lessen the impact of services for the future. So I'm not a fan of wait and see, and I do feel like, of course, we respect all pediatricians and doctors for their the beauty of their work and that they detect health and other things that might be going on. But as far as speech and language, you need a referral for a speech and language pathologist for a speech evaluation to really determine whether your child can be exhibiting delays or not. Only with that clear evaluation can you determine whether there was a delay. And so a pediatrician giving you their opinion about things doesn't necessarily give you an evaluation. And once you have that evaluation, a therapist can say, well, your child's 24 months, but they're talking like a 12-month-old. That's a 50% delay. That's pretty significant. You need the numbers to make further decisions. So I would not delay the process, even if it's your pediatrician that's saying wait and see. And myth number 5, the top things that I hear for toddlers and families that are going through the evaluation process is a parent that says, well, my husband has ADHD, or my mother says that I was speech delayed and now I have no problem communicating, so I'm not sure that we really need services if we have this history of X, Y, and Z. So we all know if you were the person that exhibited the speech delay, life wasn't very easy for you. I actually feel like I had some expressive language delays as a child, and it would be very frustrating to me when I couldn't put my thoughts into words, and I would feel embarrassed, and it made me a little bit more shy. And so why would I want my child to feel those kinds of feelings? If there is therapy and there's help out there for your child to receive, why wouldn't we want those things for our child to organize themselves and get the help that they need? I think it's really vital to think that way. So parents who often say to me, in my country, my husband started talking at 3 or 4 years old and he's totally fine now. Bilingual learners have it a little bit more tough. So I always say, if in your country, you were only focused on one language, but here, if you're talking in one language at home and then your child has to learn another language at school, now there's two different languages that your child has to work on. It's double the work. And so might as well be proactive and find out what's truly going on. And address it. Myth number 6, this speech delay I think might be due to my child hearing 2 different languages. I think parents say to me, I think my child might be confused. He hears Spanish at home and English in the community, or he hears Tagalog at home and then I speak to him in English. And so parents who mention that's so common. I mean, I can't tell you how many evaluations I've done where parents actually say that to me, that they feel like it's a language confusion. The fact of the matter is that language exposure is not a cause for speech delay. If it were the case, you can imagine how many bilingual families we would have. I mean, almost 80% of kids in the U.S. That are hearing languages would be speech delayed. That's just not the case. What tends to happen is if at 24 months children are supposed to be saying a minimum of around 50 words and putting 2 words together. So what tends to happen is 50 words still are present at age 2, and they might be code switching between 2 languages. So it could be something like quiero cookie. So it's like, I want cookie in Spanish. So there's a combination of Spanish and English, but still 2-word phrases, still 50 words minimum by 2 years old. And so that's what tends to happen. But a lot of parents do think that it's because their child might be confused between 2 languages. The only thing that would happen would be that the child confuses what language to speak at what time and with who. That's all. But it's not necessarily language exposure. Multiple languages is not the cause of a speech and language delay. Okay, so today we talked about myths, myths that I hear very often for the reason your child might be speech delayed. I hope I was able to shed some light on those myths and convince you that it might be a good idea just to follow through with an evaluation. The worst thing that can happen is for someone to say your child's doing great. And that doesn't hurt to hear. But if your child is needing services, it's best to get involved as early as possible while your child's little brains are still developing and learning at a very quick rate. So the worst thing that could happen is for a parent to wait and knowing in their gut that something could be wrong or you're not sure. And then at age 5, when it's time to go to kindergarten, someone detects that there is actually some delays and language difficulties going on then. Then your child will be taken out of class to be given speech therapy. Why go through all that if you could just get started when it doesn't really count? This is like while they're playing. Speech therapy with toddlers is fun, and it's best to just get started as early as possible. I do understand, I do hear often that it's a very difficult process. You are opening yourselves up to, saying that, maybe your child's not so perfect the way you see them, and your child is very perfect. So as an evaluator, I'm never there to say your child's imperfect and not doing well. Your child's amazing, and you know that, but can they use some help? Only an evaluating team would be able to tell you that. So I do understand it's a vulnerability thing. You're vulnerable to people coming in and giving you ideas of what might be going on, and that's scary and it's stressful, but it's for your child, not about us anymore as adults and parents. It's about your child. So anyway, well, thank you so much for listening to this, and I hope that you guys subscribe to our channel, Speech Goals, and these are Toddler Talks with Jasna. I hope to see you guys again, and if you have any comments or ideas of something that you want me to talk about, I'm super open to it. Have a great day, guys.